First of all, let me go ahead and just want to make sure we don't see all the boxes. So let me go ahead and highlight. I think that's what it's called, the video. There it
And
goes.
I'll take over the admitting duties from here.
Thank you. I think everyone knows of all the great efforts Healthy Illinois, as well as many of you here, did in advocacy in accomplishing this new program. As everyone may know, that this is Illinois is the first state to be able to be providing this health benefits, this health coverage to seniors 65 and older. We all want to make sure that everyone knows, one, not only that this program is completely state funded, and the reasons why we like to highlight that is, as you'll see at the bottom of the screen, enrollment in this program does not affect a person that may be subject to public charge. Again, and the main reason is because it is state funded. We'll go in more into the specifics and the details, et cetera, but just wanted to emphasize that point right now. The coverage, so what's included in this program, there's similar benefits as many of you that assist individuals in enrolling in the AABD program, Aid for Age Blind and Disabled. They may qualify through spend down as well as fee for service Medicaid to begin. One thing to emphasize as well as through this program, individuals will not be covered for any type of nursing facility services or home community-based services. But again, there are a lot of other things that are covered, but we just wanted to highlight that the nursing facility services and the home community services are not included in this program. Some of the things that are included, this is just a quick snapshot that Kristen pulled together through the policy document. You'll still hear, I'm not going to read through all of them, but again, you'll see that the list is pretty extensive. My personal suggestion is think of it as kind of like the Medicaid program. It covers a lot of the similar services for an individual that qualifies based on his or her income, as well as long as a person is 65 and older.
And Luvia, if I may add, you'll see home health is listed here. And so some people may be wondering what's the difference between home health and home and community-based services. So I just want to be clear about that. You can think of the home health services that are covered, those type of medical services that are provided in the home. So it might be medication delivery, it might be something like physical therapy, something that is treating a medical condition and is being provided in the home. Home and community-based services is something different, and that is one of our Medicaid waiver programs, and it's really designed to help the individual with their activities of daily living to prevent them from being institutionalized in a nursing facility. And so those are two, the nursing facility and those home and community-based services, those are very high cost services. And so it's just important to note that those are not included in this new program. Thank you.
Thank you for the clarification, Kristen. So who is eligible for this program? I kind of, you could say, reference it beforehand. So one is people that live in Illinois. I like to say that because the language does say Illinois residents, but don't confuse that for anything to do with immigration status. So people that live in Illinois are 65 years or older, and their monthly income is at or below 100% of the federal poverty level. And there are some examples here. If it's just one person, as long as their income is $1,063 per month. If it's, for example, husband and wife, then the monthly income would be about $1,437. Again, these are just examples. There is there is, you could say, the asset limit, but keep in mind that this asset limit or this asset test is not being considered during COVID. There is a state of emergency. It was issued during COVID, so this is not going to be considered. Just one quick example when it comes to assets that in the future could be considered is if an individual, for example, has their house where they live, but they have like an additional summer house or something like that. Again, just a quick example. In regards to who qualifies, it does include undocumented individuals that are 65 or older. It also includes individuals that are lawful permanent residents, also just known as people that have a green card for less than 5 years. There may be other immigration statuses that qualify for this, but we know that the majority in Illinois are under these two buckets per se. But again, as we get more information and depending what questions you get, keep that in mind. But I know that one of the other groups that are eligible, and there are a number of them in Illinois, are people with temporary protected status, TPS.
Luvia, real quick, we had a question come in that I think is relevant to discuss now, and it was just, can we explain a little bit more about assets?
Sure, I'll turn it over to you, Kristen, on that one.
Okay, sounds good. So the AABD program, which this new program is modeled after, does have an asset limit. So for a single person, assets are usually limited to $2,000. For a couple or two people, a household of two, it's limited to $3,000. Assets are resources that includes money in the bank, whether that's checking or savings, technically even cash on hand. So if they have a bunch of cash under the mattress or something like that, it can include property owned, but there are many assets that do not count for eligibility purposes for this Medicaid program. So the home that someone lives in, as Luvia mentioned, does not count, but if they have a second home that maybe they use as rental property, or a second home, you know, in another state or even in another country, that property would count for their eligibility. It can include certain retirement investments, things like that, over a specific dollar amount. So if you are interested in knowing more, we can certainly discuss that later, or maybe in a point you to the resources about that with state policy. But I do think it's important to note again that during this COVID-19 state of emergency, the state is not currently doing the asset test for Medicaid eligibility. And one last comment, this asset test is different than what's needed when people are going into a nursing home or long-term care facility. That's a completely different process. So this is really just about Medicaid eligibility, low income, low resource, or low asset individuals.
Some other questions that have come up, Kristen, and as Kristen said in the beginning, we may not be able to get to all of them, but please know that we are keeping track of all the questions. One of them that I personally don't know the answer to is Elizabeth Liu, I think, is asking, does a $25 income disregard apply to this program?
I know that it applies if someone's qualifying under spend down, and I would have to defer in terms of just general Medicaid eligibility. I would have to defer to the HFS staff on that one.
I can only say, without knowing that specific detail, if $25 is allowed for ABD, it's allowed for the 65 plus program. We're going to count income exactly, and assets exactly when the time comes to count assets, exactly as we do for ABD.
Great, thank you. And I do see the next question, Luvia, from Christy Wessel about burial plot. And yeah, prepaid burial expenses, funeral expenses, I believe it's limited at $1,500. I can find that policy reference for folks though. So it might be helpful to, as we continue to develop fact sheets as community partners, we can certainly kind of get into assets a little bit more. The good news is though that it's always asked on the application. So when we're helping someone apply, you know, as soon as we kind of check that they're age 65 or older, or for persons with disabilities, the ABE application will ask for these assets.
And Kristen, some of the, just so everyone, some of the questions, Linda, that you're asking, as well as Joshua, we're not going to answer those because those are going to be answered in the presentation. But I think this one is not, Kristen. I think I know the answer. Can someone receive rehabilitation services after a hospitalization in a skilled nursing facility? I think the answer is yes.
I would need to double check. I think it's yes as well, but I would need to double check.
I think we do not cover nursing home. We do not cover nursing facility.
No,
days.
the question
Rehab
is,
at a rehab hospital would be acceptable, but nursing facilities are not a covered benefit.
But it's for skilled care. It's not for custodial care. And I believe I'm bringing this up because I think other people need to hear this, but I believe it would be covered skilled care at a nursing facility, but not as custodial care where someone's in there for a long-term period of time.
I don't believe it's covered, but we'll check.
Well,
I don't believe.
yeah,
yeah,
we'll double check. We'll double check on some of the questions that we're unclear about.
Thank you for bringing that up. Great.
Great. We're going to go ahead and pause for the questions for now, if that's okay with everyone, and then we'll go ahead and continue because we do have a lot to cover, and we're only on slide 7. Why is this not moving? There it goes. So when does the program begin? So the program actually began already December 1st. The rules were finalized December 12th. That's more of, you could say, on the policy, behind the scenes things that had to happen. One thing for everyone to know is that services can be covered or backdated for no more than 3 months. So what does that mean? Here are 2 examples. Jack applied on December 20th, 2020. He was in the hospital in September. He can request backdating to September 1st of 2020. Another example, Sydney applies on February 10, 2021. She can request backdating to November 1st, 2020. So again, the purpose here with these examples is that people could request up to 3 months. That's something, one, if they have medical bills, for example, they could just notify whoever is assisting them in applying for this program. When it comes to the backdating, here's a screenshot that Kristen included from Abe. We did highlight in red that it'll tell you just simply here the months as examples of when you could go up to, again, it's up to 3 months only. How to apply for this new program. It is year-round, meaning there's no specific application deadline, there's no specific timeline, etc. So it's pretty much any time. You need to submit proofs at the time of application that include income, medical expenses, any immigration or citizenship document available. You do not need to enter the ITIN if the applicant has one. As a reminder, ITINs are only for purposes of filing taxes. A social security number is not required, though we do know that especially those that are legal permanent residents under 5 years will have one. But this note is specifically for those that are undocumented, that again, a social security number is not required. A little bit more information of how to apply. So you could apply, the individual could apply directly on Abe. You could also apply by phone. The phone number is here. You could also contact an application assister for help in applying. All these, by the way, do have direct links, and this will be shared again sometime in the early next week. You could also contact a community service agency for help in applying, and they have assistance in over 59 languages. This is through both the combination of the Immigrant Family Resource Program as well as the welcoming centers. And you could also apply by mail. And again, there are links here for both the paper application, or you could also just request it by calling the Abe customer call number. Here are some examples of proof of Illinois residency a person it may be able to submit when they're applying. Again, either rent receipts, I'm not going to read all of them, utility bills. One that I am going to highlight is when you see contact from family or contact from landlord, that could be a letter. From either of them. We know that in the immigrant community, there are different generations living in the same household. So for example, if the individual that's eligible for this program is not on the lease or is not getting any kind of, you could say, utility bills under his or her name, somebody from the family is able to just write a letter on behalf of that individual saying that he or her lived there, just as an example of the contact from family or landlord. If people do have some type of document from another country, whether it be a matricula or something similar, that has the address of Illinois, that is also a valid proof of Illinois residency. You will see one of the people that had this question, you'll see from this slide, there you do not need to have, you do not need to live in Illinois for a set period of time to be eligible for this program, but you do need to have one of the following documents in this slide. Here is an example. When it comes to residency, Vaughn rents a room from Eric. He does not have a lease. Vaughn can provide mail as proof or ask Eric to sign a letter stating that Vaughn lives at the address. What if Eric is unwilling to sign a letter? I'll go ahead and allow Kristen to go ahead and answer some hypotheticals of what could happen if Eric is unwilling to sign the letter.
Right. So I think we sometimes have this challenge, especially if people are not receiving mail at their address. But I mean, they need to basically have some sort of proof that they are an Illinois resident. There are also ways, you know, if someone is homeless, that they can attest to the fact that they're homeless. It could be that a social service agency, you perhaps as an agency that assists this population, you could write a letter on your letterhead explaining that this person is known to you and you know that they reside. Same thing if you know that they are homeless, you know, that you would indicate that in the letter. But really it's just helping to brainstorm from the list from the other slide what can be used as proof of residency.
Thank you, Kristen. And thank you, Jane. I know Jane has been answering some of the questions in the chat, so thank you. When it comes to counting the number in household, how does that happen? How does that occur, etc.? So when it comes to counting the number of people, it includes the applicant, the spouse living in the home, and children under 18 living in home, unless the applicant requests that they not be included. Keep in mind that as the first point says, there is the AABD eligibility that uses a non-magi budgeting. But again, we are talking about people that are 65 and older. So more than likely, it probably will just be the individual applying and possibly his or her spouse. And again, the person does have the opportunity to say that if they want to include any child, if they do have one under the age of 18. Some examples when it comes to the number, how to count. Sloan, age 67, is undocumented and lives, sorry, I'm having to move these little boxes around, and lives with his spouse who is a US citizen. They have no children living in the home. When Sloan applies, they will be considered a household of 2. Another example, Francie, age 70, is a widow who has been an LPR for 2 years. She has no income. She lives with her adult son, his spouse, and their 2 children. Francie's son claims her as a tax dependent when he files taxes. Francine is considered a household of 1 when applying. And again, this was just simply 2 examples of one person who is married, lives with a spouse, versus the other one who is a widow, lives with her adult son, but has no income.
And Luvia, I'm just going to jump in because I saw at least one question that kind of relates to my second example here. And so the way it works, especially with the online ABE application, which I have to stress that is the best way to apply because then you have that record. When you fill it out on the ABE application, if we were to put Francie's son and his spouse on her application, once we're in the section that indicates the relationship to other people in the home and even tax filing status, and then, you know, we've already marked that Francie is age 70, kind of behind the scenes, the algorithm or formula, however you want to call it, me being a very non-tech computer programming person, that's not my wheelhouse, right? But anyway, behind the scenes, that's how the eligibility is calculated based on how we respond to those questions. So even if we were to put Francie, her son, and the son's spouse on the ABE application, it's not going to count their income for Francie's eligibility. I hope that makes sense. And we'll come back to some other questions in a few moments.
Thank you, Kristen. I'm going to go ahead and raise one of them because I know one of them is pretty common, which is what if a couple lives together, but they aren't legally married?
So I'm going to talk about just this program. I'm not going to talk about other benefits. So yeah, technically, if they're not legally married, really the policy looks at who are you legally responsible for in terms of eligibility. And so when we talk about those relationship rules for the AABD program, we really are talking about legal spouses or those children who are ages 18 and younger.
Thank you. Again, we are keeping track of all the questions, so they are going to be saved if your question does not get answered. We are going to follow up with a document that has all the frequently asked questions that we've been compiling. So when it comes to proof of income, there are a couple of different options for the individual, whether it be pay stubs, employer statements, pay envelopes, self-employment bookkeeping records, tax returns, and again, just some examples. But if you do click on under the word more, there is going to be a link to other options as well. And know that if a person gets paid in cash, they are able to either one, get a letter of their employer or submit whether it be maybe bank statement or other possibilities, possibly. So again, just keep in mind that there are a couple of different options. So just make sure that you review under the more for all the different options. One example when it comes to proof of income, Irina is self-employed and cleans homes for her income. Her clients pay her in cash. What can Irina provide as proof of income? As I briefly referenced, she would be able to either submit the document she uses for filing taxes or be able to just, I believe one of the options, Kristen or Jane, is to self-attest when it comes to the income as well.
Yes, that has been an option in the past, that if the client even has records, if they even have a ledger, there's even a form that they can use to document kind of the self-employment income.
And in regards to the question of what if the kids support them, I believe same as with this, one of the children could just write a letter saying that he or she supports them, correct?
Yes, so that if it's given on a regular basis, that would be considered unearned income and would need to be reported. So if they're giving like a regular, I don't know if you want to call it an allowance or, you know, some type of support, it does need to be reported.
And then one question, Kristen, is would you look at the past 30 days for income qualifications? I'm guessing the question is monthly versus annually, maybe?
Right. When applications are submitted for state benefits, including Medicaid, yes, they typically look at the previous 30 days. However, if they are requesting that backdating, they're going to need to show that proof of income eligibility for those past months as well.
Great. We're going to go ahead and move forward because I know that we still have a good bunch of. There it goes. I'm going to go ahead and turn it over now to Kristen, who's going to discuss spend down. Please keep in mind that we know that spend down is complicated. I personally am not, know very little, if nothing, on spend down. So we will be following up in the survey evaluation for individuals that want more of an in-depth training. Kristen and others would be happy to just want to caution people that you don't need to know everything on this. Kristen just wanted to share with people at least a little bit on this.
Right, because I think sometimes spend down is a grand mystery for folks. And really the reality is we wanted to give you just a baseline understanding of spend down because individuals who are applying through this program may qualify through spend down. That is an option. So this is meant to be just a very basic introduction Please keep in mind when I conduct Medicaid trainings, and some of you have participated in those, you know, spend down can easily take 45 minutes.